It's not in prepping these teeth into little triangles and then slapping on porcelain or zirconia, which patients are like, are you going to use zirconia? It's the strongest. I'm like, I don't know if zirconia crown is actually stronger than your own natural tooth, right? So maintaining the strength of your original natural tooth is way more important than trying to make these teeth into triangle and adding crowns on there. So then the next other important thing is making sure that the outcome of the teeth, of the veneers, looks the same. So we always talk about taking shade photos. The teeth in her smile are all the same aside from that one tooth. So my ceramist needs to know exactly what the colors are so that we can mask it and the end result is going to look uniform and you won't know that that single tooth was a little bit darker. That's just for me and her to know, right? And so here you can see the porcelain on the model. We're creating canines to be nice and sharp. Those original two teeth were in the same length as we talked about before. You can see the beauty, the texture, the translucency. If we just made thick porcelain, you wouldn't have this beautiful element in the porcelain, unfortunately, because there has to be a lot of building up of material to get here. So as you can see from the back, it's crazy to think about it, but there's still a tremendous amount of tooth intact. And then what you're seeing over here is a communication between the ceramist and I where I'm like, hey, I've mounted the case. I see that you need a little bit more space between the lower and upper tooth. So can you just, upon delivery, just do a little bit of reduction there? I love it. We communicate so much. I think it is critically important to make sure that the person that you're working with understands your capabilities, understands your vision, and can get you the result. So rather than making the lower teeth smaller and saying, oh, I don't think there's room for it, hey, can you reduce about 0.5 millimeter so I can get that canine into the places that I want them so those points of the canines can slide along the upper canines nicely. And so as well, the same thing on the back of the lower teeth, protecting those lower teeth from having to grind them away. 3 years later, this is what her smile looks like. This is what her teeth look like. No chipping, everything's healthy, very compliant patient, really important. And you can see from the side view where all of the teeth that we put in, this is just, porcelain is staying the same. There's no fractures in the porcelain. There's no compromising in the porcelain. She's just now a really happy patient that she went with this approach versus having to shave a lot of her tooth. And so this is where we started. That's where we finished. This again is where we started. And this is a 3-year outcome of transformative, healthy, long-lasting dentistry that I am proud of doing, and I'm very happy for our patients to be trusting what we do every single day.